Hello, my name is Eben and I'm in grade 7.
Tanse Guakida. My name is Dr. Eric Mandawi. I'm Bush Cree from the Beaver Lake Cree Nation in northern Alberta, and I'm a resident doctor in Halifax through Dalhousie University in plastic and reconstructive surgery.
What does a plastic surgery resident do?
Plastic surgeons have a few different roles, and primarily we work as surgeons to help with reconstruction. So if you think of having to build something up and make something new, we do that with the human body. Sometimes that's with the face, sometimes that's with the chest, sometimes that's with the legs. So we work head to toe when it comes to reconstruction. So we cut and we sew, and once all of that is complete and we've got our reconstruction together, that person may look very different. And it's to help with not just the way that they look, but how that functions as well. So when we reconstruct, our goal is not to just make it look like a mouth, but also that it works like a mouth as well.
What do you need to do to become a plastic surgery resident?
In order to become a plastic surgeon, I had to go to medical school. And before medical school, I went into music prior to medical school. What I find as somebody who's now working in surgery, specifically in reconstructive surgery, there's a deeply creative aspect of this that, for me as somebody who loves to work with their hands, creates things on a daily basis, whether that's musically or otherwise, that I knew I needed to have as part of my career. So becoming a surgeon is something that is inherently creative, and you work with your hands and you create something new every day. But what it is we create is within the human body. And that itself is something that's really special, and something that I honor every day. As this is such an important and meaningful role to have in this lifetime.
What is your favorite thing about being a plastic surgery resident?
I think my favorite thing about being a plastic surgeon, for me, it just has to do with seeing people every day. You're able to see them one day, before you do any operations. You meet them, you get to know them, you see what their issues are, you see what brings them joy, what makes them happy. And then you see them in the operating room, and you're able to use the skill that you've developed, that talent that you have in working with your hands and your eyes and making something new. And then you do the surgery, and then you see them afterwards, and they sometimes look like a very different person. They look like a brand new person if you were somebody who was born with a facial difference, and then you change that face to recreate something new that allows them to speak better, to eat better, to interact in this world better. And every day you get to interact with people that are going through these things. So you get to share that gift that you have, as somebody who's a helper to people.
What made you choose this job? Did you know anyone who was a plastic surgeon when you were growing up?
For me, wanting to go into plastic surgery wasn't really something that I knew I wanted to do as a young person at all. Honestly, I've always been an artist. I've always worked with my hands and been creative in that way. But for me, I didn't have any role models specifically who were surgeons, aside from my mother. She's a nurse, and she most of her career worked in labor and delivery, so they're the nurses who help deliver babies. And all of her stories working in the hospital, I always thought that was an interesting place, but I wasn't sure that delivering babies would be something for me. There's so many specialties you can go into, whether that's family medicine, general surgery, ear, nose, and throat surgery, psychiatry, or just general medicine. And for me, I knew that working with my hands was important, doing something creative was important. I didn't have any mentors or people who I looked up to in those spaces who looked like I did. But I knew that this is something I wanted to do, because maybe there would be a way for me to then get into that space and then help guide the next generation of people wanting to do that kind of work. But my mom was a really big a proponent, somebody who inspired me to do this kind of work, albeit she just wasn't a surgeon, but was somebody who still worked in healthcare helping people. So I didn't have role models per se, but I certainly had people who were encouraging me to do the work that I wanted to do.